Hello and welcome, viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold Learning. And today with me, I have two special guests who will be presenting at the Gold Lactation online conference here of 2021. I have Dr. Rachel Walker and Dr. Divya Parikh with me. Welcome, you two.
Thank you for having us.
Yes, thank you.
It's wonderful to have you here today. And before we had our little recording here, we had a little chat, and it was quite interesting to me to hear your story. Tell our listeners, how long do you know each other, and how long have you been working together?
So I could start with how long we've known each other. We actually met in 10th grade chemistry and continued on to be friends from there on out. Yeah.
Yeah, so we both ended up going to Penn State for undergrad, and so we stayed friends through Penn State, and then we kind of went different ways after college. Divya became a pediatrician, and I got my PhD in nutrition. And through those things and through having our own kids, we both became interested in human lactation. So then we kind of started talking about professional interests.
Yeah, I mean, I ended up going pediatrics medical clinical route with obtaining my IBCLC, and Rachel chose a focus in human lactation in the nutrition department. And so we realized we had some common interests.
That's absolutely wonderful. And then you decided to work together.
Yeah.
And looking at this, and I know I mentioned this earlier to the two of you, looking at this, we have a pediatrician, we have a nutritionist here, PhD in nutrition. This is the dream team. You're bringing together all the elements, and the work you do together is having a huge impact at the families you serve, and also, of course, the research you produce.
Thanks. Yeah, it was exciting to talk to Rachel again after so long and realize that we had this interest, because I felt that, with a lot of the clinical advice that I give, I wish there was more we understood about the physiology and the metabolism that goes into a lot of milk production and milk composition. And so I was like always thinking, I wish somebody was working on this. I wish I could help. And then Rachel showed up again.
Fantastic.
Yeah.
And Rachel, in the beginning, as a nutritionist, the interest came later, as you mentioned, after you having your own children as well, or?
Well, yes, that was part of it. I was in my PhD, I was studying inflammation and insulin resistance. And through that process, I came to discover that there really was not much known about treatments for lactation problems, and that there was a strong link between insulin resistance and lactation difficulty. And there was very little research. So I became really interested in working on that, and I've been working with someone at the University of Cincinnati to develop proposals, and Divya's helped me with those as well.
Oh, wonderful. Sounds absolutely fantastic having that. The two of you being friends and now working together and making such an important contribution here. Fantastic. So let's talk about the presentation here at Gold, the breast milk. It's titled Breast Milk Fat Profile Implications for Clinical Practice. Tell us a little bit about what we can look forward to.
Well, so there's quite a bit of research that's been done as far as the fatty acid profile. So for example, how much omega-3 is in milk. And there's quite a bit that we know about how you can increase, especially DHA in milk. What we don't know very much about is how to affect the total amount of fat in milk and what effect that has on infants. So we're going to go through the knowledge that is out there, and also some of the things that we don't know that need to be studied more.
And my portion of the talk is going to focus on clinical aspects of human milk fat. And, there is less known, even so, on how clinically this plays out. I think most of the research right now focuses on how it impacts in donor milk banks, because you can actually quantify and really monitor that. But, in a routine outpatient settings where families are directly breastfeeding their infants, that becomes a little bit trickier to measure and a little bit trickier to know truly how big of a factor is it in the infant's growth.
Absolutely. I love how you have this combined aspects of the research and then the clinical aspect as well here. A wonderful combination there as well. And my question now is the breast milk fat profile. You mentioned, yes, it's easier to measure or to analyze in a setting like for milk banks, for example, right? In that kind of a setting. But how to do that in a day-to-day basis, with our clients, for example, with our families and our
Yeah.
lactating moms there.
So that's a good question. There are some commercially available milk fat analyzers out on the market. There are so many factors that go
Hmm.
into what affects milk fat. And so it is very hard to draw a full conclusion off of small sample sizes that you can only ethically give
Yeah.
small sample sizes when you're feeding your own child. Um, so they are available. I will go through a little bit on like kind of the pros and cons of them and what appropriate use would be.
Hmm.
Um, and so, yeah.
Absolutely. Wonderful. Yeah. Thank you for that.
Mhm.
Um, and a question now before I let you go here, and we're looking forward to the presentation, of course. As this dream team here together, what piece or nugget of advice can you give our listeners out there when it comes to the topic of breast milk fat profile? I understand we don't have time to a long lecture, but what is it that you find important if you could just give that little nugget of information to us?
Yeah, I think one of the things that we can definitely say is that diabetes and some other nutritional stressors like iron deficiency are definitely related to low milk fat. So
Mm.
they could be impacting how sufficient mom's milk is for baby. And so some things like that need to be monitored, and those moms might need extra lactation support.
Mhm.
And then also it's important for moms to understand how their milk fat changes through a feed and throughout the day. And it's very important to make sure that infants are getting a full feed because most of the milk fat is going to happen in the hind milk, which happens at the end of a feed.
Mhm. Very good.
I would say my nugget to part with would be the importance of good maternal nutrition,
Mm.
and maybe perhaps bringing that out a little bit more than you typically would in a clinical setting. And really, when you are assessing how feeding is going, also perhaps asking the parent, how
Yeah.
are you eating while
Yeah.
you're, trying to feed your child every 3 hours as well. So yeah, addressing
Yeah.
maternal nutrition.
Addressing maternal nutrition so important too, because yeah, we focused on the baby, on is the baby getting, how is the baby growing, but we often forget how, especially in the first few weeks after postpartum, how hard it is for moms to really get nutrition, it's and make sure that they're getting the right kind of nutrition as well. Well, thank you to the both of you for sitting down here with me, Dr. Rachel Walker and Dr. Divya Parikh. It has been such a pleasure talking to you, and I'm looking forward to the presentation.
Thank you.
Thank you very much.
And to our listeners, the presentation Breast Milk Fat Profile Implications for Clinical Practice will be live on April 20th. And as I mentioned, is part of the Gold Lactation Online Conference of 2021. And if you want to find out more about this presentation and the other presentations in the conference, we would like to invite you to visit goldlactation.com. Thank you again, Dr. Divya Parikh and Dr. Rachel Walker, and to all our listeners and viewers out here. And we hope to see you at the conference. Bye bye.